for Nashville.
Don't waste what we've done. This has been very hard. This progress is painfully won.
A painful process toward progress, but tonight we are not out of the woods yet. Good evening, everyone. Thanks for joining us on air and streaming live in the News 4 app. Nashville seeing a spike today of coronavirus cases and deaths here in the last 24 hours.
And tonight, workers on the front lines in hospitals are telling News 4 Investigates that the dying process is unlike anything they've ever seen. Let's go live to our chief investigative reporter, Jeremy Finley. Jeremy, what are you seeing? What are they telling you?
Well, Tom, they say that this is really more of an emotional pain for these patients than anything else. This virus means that as these patients are dying, their family members cannot physically be in the room with them. It's a harsh reality that these frontline workers are trying to overcome.
If COVID-19 has taught this hospital anything, it's that death is different now.
That sort of dying process is really I've never seen it in 30 years.
Beyond the ventilators, the masks and the gloves that have become synonymous with treating dying COVID-19 patients, those on the front line say the public also needs to see this, the glass door.
I was recently heartbroken to have a patient die and the spouse having to be outside the window because they were too scared to enter into the room.
A highly contagious disease means preventing a physical goodbye.
How difficult is it for these family members to not even be able to touch these people they love?
My heart breaks because we're not able to connect in the same way.
The people who are dying from this, are they also extremely lonely?
We're so accustomed to reaching out our hands, and sometimes they just want to hold a hand, a family member, a patient, and it's really hard to not be able to offer that.
So if comfort couldn't be felt, it would have to be heard. Nurses are providing playlists for patients and families to choose their final music, and it's not always what you'd think.
I have never heard Freebird as often as I have here in the hospital.
And while this glass separates,
So I have one here.
another provides a screen for families to call in and finally get their last FaceTime.
It's those moments where we were able to find connection. Those are the things that will help us move on from this.
All right, as we said, it's a grim reality, but the doctors say this is something they want the public to know, as some people may be thinking that they don't have to take this as seriously the longer it goes on. Now, there is some variation to the touch in this. If a family member isn't in the high-risk categories and they're wearing PPE, they can be able to come into that room and sit with a dying patient. Tracy, back to you.
Oh, Jeremy, that is so powerful. Thank you very much. You know, we give you the numbers of deaths every night, just like we're about to do here, but that story really humanizes the data. Since yesterday, 2 more lives were lost in Davidson County. That brings the total to 27 here in Davidson County. 204 people across the state have died. Metro Health confirming 163 cases reported in the last 24 hours has brought the total to nearly 3,000 now, but nearly half have recovered.